They are killer diseases that affect people on almost every continent every year. Combating HIV/AIDS, tuberculosis and malaria strain medical resources, leave families blighted and cost lives. Well, starting today, a conference in France is hoping to raise funds to combat these conditions and to condemn them to the history books. The Global Fund Forum aims to save 16 million lives within the next 4 years. It hopes to avert 234 million infections worldwide, and it'll do this by raising €12 billion from international governments, companies and individual donors. The triennial event, which is being hosted in Lyon, is a partnership of governments, NGOs and companies. Natalie Hewitt reports on the fight against tuberculosis, a disease first recorded centuries ago, but still a prevalent killer.
A persistent cough, fatigue, weight loss. The symptoms of tuberculosis are not obvious. Its consequences are. TB kills 3 people every minute. It's an insidious epidemic. Experts estimate a third of people who have TB go undetected and untreated, infecting others with their cough. Many who are treated just don't get better. Drug-resistant TB is on the rise, and the Global Fund warns it poses a potentially catastrophic risk to global health security.
TB is transmitted through air. You can get TB anywhere you go. And I think the best way to prevent, your country or your people to get TB is to really fight TB where it comes from, because anyone can get because of the migration we have. So I think countries need to wake up.
Over time, bacteria and viruses naturally learn to resist the treatments meant to kill them. That effect is compounded when drugs aren't taken properly. That's easily the case with a disease like TB, where patients have to take several courses of antibiotics for at least 6 months, with limited success and often debilitating side effects. As the pool of effective drugs dries up, the world needs to upgrade its toolbox with new diagnostics, vaccines, and treatments. But tuberculosis overwhelmingly affects poor people in poor countries, and companies have found little incentive to invest. When Johnson & Johnson's new TB drug was put on the market in 2012, it was the first one to be approved in 40 years.
It's very expensive. It's as expensive as another drug to develop for TB, like a cancer drug or an immune drug. It takes the same time, the same effort. But if there is no real market in the world, it's very difficult to put $1 billion behind the TB development program.
But the problem is getting too serious to ignore. Each year, drug-resistant TB kills nearly 250,000 people, almost 1 every 2 minutes. It's spreading fast, and it's now at Europe's doorstep. In Belarus, Russia, and Kazakhstan, more than 1/4 of new TB cases are drug-resistant. Last year, the UN General Assembly committed to step up the fight to end the epidemic by 2030. But the Global Fund admits that right now, the world is not on track to meet that target. Natalie Hewitt, Euronews.
Well, join me now in the studio is Mitt Phillips, Health Policy Analyst at MSF Doctors Without Borders. Thank you for coming in. Great to talk to you. Let's just start with what the Global Fund has achieved so far, because this obviously is a renewing of the commitment to say we're really going to tackle this.
Yeah, well, we see a lot of difference over the last 10 years. Money from international sources, and the Global Fund is one of the biggest sources really that we see. In some of the countries we work, the Global Fund is the only one who is also paying for treatment for HIV, for example. So we have seen this difference, and we have seen the impact on the lives of patients. On programs, we have managed to increase the coverage of treatment for HIV, also for tuberculosis, and for malaria. It has been a great difference. But there is still gaps, and so that's of course that's why we need also to continue the fight against HIV/AIDS.
There's some very ambitious timelines outlined by the Global Fund. How feasible is it to actually end these epidemics in the near future?
Well, I think we can really make a further impact. We know what to do, and that's for sure. We have developed some very interesting strategies. We have also improved the treatment possibilities. We have found ways to include community in here, patient-centered care, and that makes a lot of difference. And if we can continue that, that I think it will make really the impact that we are looking for. But as I said, there is problems to be solved, and we have challenges. There is resistance against the drugs that we're using, so we need to adapt constantly to remain on top of things.
We've just heard a little bit there about tuberculosis. Actually kills more people than HIV and AIDS around the world. What are the challenges when it's a disease that affects people in poorer countries, and normally poor people in poorer countries?
Yes, both HIV and TB, they have a massive death toll in low and middle income countries. And so we have about 770,000 people that were killed by HIV last year, 1.6 million for TB. So it is huge numbers. And the worrying thing is that for HIV, for example, we are not seeing the numbers coming down fast enough. So
why do you think that might be?
Well, for example, we see in our clinics that people come in very advanced stages of disease. AIDS, like we used to know it. And this is often because people are or late in starting the treatment, but also their treatment is not working anymore for them. So we have to switch them to other treatments, other drugs, really.
Is that something you see then more in poorer countries than you do in the more developed ones?
Well, it is sure that in poor countries there are more obstacles for people to come forward in time to start the treatment. We see, we did a report recently on 9 countries, and we see there is important gaps, financing gaps, but also services gaps. We don't have always enough drugs to put people on treatment as needed. We have not necessarily the funding to make sure that the testing can be done. So if you don't test people, then you will not be able to put them on treatment. So these are things that remain to be done. And of course, we are still struggling also when we have to change treatment for the resistance, for example. These drugs are more expensive. So, for example, we're doing an action on bedaquiline. This is a medicine for resistant TB, which is very important so that people can switch away from injectables, from very painful and toxic treatments. But the price is still too high. We're trying to bring it down. We're asking G&G to bring it down to $1 a day. And that would be feasible, and then we can do it.
Thank you very much for speaking to us. Mitt Phillips from Doctors Without Borders.